Okay, so we're going to talk about alcohol during this lecture. Probably the drug most of you are familiar with, aside from caffeine. Obviously, legally available in the United States for those over the age of 21, and certainly something that most of you will be familiar with. But it's important that we have a good understanding, as much as we can, about the function of alcohol and how it's different from other drugs. To give you a little bit of an idea about the demographics behind alcohol, over 14 million Americans have problems with alcohol directly. Of those, 7 million would be classified as alcoholics. Here's a staggering statistic. 10% of the drinkers in the United States drink 50% of the alcohol. The other 90% of us drink the other half. That's a lot of alcohol. That's some heavy drinking. So there are people who clearly have a problem with alcohol. There's all sorts of interesting things emerging about alcohol that we didn't know before. There's genetics behind alcohol, certainly a genetic component to the risk for alcoholism, which we'll talk about in our next lecture. There's even now clearly a genetic component to liking the taste of alcohol, which again makes this a much more complicated picture than it might used to have been. Obviously, most of you should know, if you've had, a science class ever, that the alcohol that we drink is ethanol or ethyl alcohol. There are, of course, other alcohols like isopropyl alcohol and methyl alcohol or wood alcohol. These are toxic. They're metabolized into formic acid and then formaldehyde, which results in vomiting, blindness, coma, and death. So make sure we're drinking the right alcohol. Now, alpha alcohol is used in a wide variety of substances, mouthwash, for example. Many of you who've watched the show Intervention, I keep meaning to try to find some episodes to post. There are people who will drink mouthwash, which I find horrifying. But so there's a wide variety of uses for it. But it's important to understand which alcohol we're talking about. There are, of course, three major types of alcohol, which should surprise nobody: beer, wine, and liquor. Beer tends to be around 3 to 6% alcohol. I'm from Colorado, and up until recently, the only beer you could buy on Sundays was called 3.2 alcohol or near beer. When I was younger, some time ago, you could buy 3.2 beer if you were 18, but only stronger beer, alcohol, and wine if you were 21. Microbrews have a much stronger alcohol content, up to 9%. Some beers now have 10% alcohol. Beer certainly is an old technology. The first recorded brewery was in Egypt around 3700 BC. There are now actually anthropologist brewers who are trying to recreate beer that hasn't been around for thousands of years. So there's a beer that you can get that is, I can't remember what the king's name is. Not Midas. Think of it later. Anyway, they found this leftover brew from ancient times and have actually recreated it, and it's Dogfish Brewery, and I can't remember what it is. So I apologize for that. But I am sitting in my office on a Sunday recording these, so anyway. Beer's been around a long time is the answer. Those of you who are familiar with this area, Asheville has more breweries than probably anywhere else in the area. I'm from Fort Collins, Colorado, which is about the brewing capital of the country. So, lots of beer. Wine tends to have a little bit higher percentage alcohol, about 12%. It can be fortified to 20%, which is usually done with distilled spirits. Both beer and wine are limited in how much alcohol content they'll have because of the fermentation process. Wine dates back to about 5400 BC in the area of Iran. Distilled spirits are usually around 40 to 60% alcohol. Normally they're given a proof rating, which is 2 times the percent of alcohol, so a 100 proof drink will be 50% alcohol. It's the reason why Bacardi 151 is so dangerous because it's 151 proof, which means it's 75% alcohol. We do know that wine was converted into brandy during the Middle Ages, and this started the distillation process. So most of you, again, I imagine know this because I know we did this in 8th grade science. Alcohol is produced by fermentation. Sugar and water in the air are invaded by yeast. Usually you add yeast if you're going to actually make alcohol, which is then converted into ethanol and carbon dioxide. In beer, we capture that carbon dioxide, as well as champagne, to keep things bubbly. The yeast cannot survive in the high alcohol concentration. At around 10 to 15% they die. So you only produce beer or wine with fermentation. Spirits have to then be distilled. And so in distillation, we remove the water, which then increases the alcohol content. Brandy is a distilled form of wine. Whiskey is made from grains. Rum is usually made from sorghum molasses. Schnapps is made from potatoes. Tequila is made from the mezcal cactus, or the agave cactus. Gin and vodka tend to be a mixture of pure alcohol, water, and flavoring. There is, of course, vodka made from potatoes as well. Gin is vodka flavored with juniper berries, and of course vodka, you can now get vodka in every flavor you can imagine. There's whipped cream vodka, marshmallow vodka, and all sorts of crazy stuff. In terms of measuring an alcohol serving, a typical serving of an alcohol beverage should contain about the same amount of alcohol. A 12-ounce beer and a 5-ounce glass of wine and a 1.5-ounce shot of liquor all have about the same amount of alcohol. Very handy for keeping track of how much you've had to drink. Of course, we talk about blood alcohol as our blood alcohol concentration, and which is usually the milligrams of alcohol per 100 milliliters, which is, of course, a deciliter of whole blood. But we express it as a percentage of alcohol in blood. So 80 milligrams per 100 milliliters is 80%, which would, of course, be lethal. There are, of course, important things to understand about alcohol blood percentage. It varies by body weight and gender. And, of course, at most places, 0.08 or below or above is the limit for driving under impaired, or driving with ability impaired, or driving under the influence. They want to lower that to 0.05, or even lower, which would be maybe 1 or 2 drinks. You can see on this chart 1 drink for someone who is my weight would be 0.02%, 2 drinks would be 0.04, so I could have about 4 drinks before I hit the legal limit. I don't think I would ever drive after drinking that many, but women, of course, have much lower tolerances, and that has to do with the metabolic enzymes in the GI tract. In terms of the pharmacokinetics of alcohol, it's rapidly absorbed from the stomach and small intestines. Alcohol is both lipid and water soluble. 20% of our alcohol gets absorbed from the stomach. This is, of course, affected by the presence of food. Most of you should know by now, if you eat before you drink, it will be absorbed more slowly, so it's much healthier, much better to have something to eat before you drink. Of course, the volume and concentration of dose is going to depend on how much alcohol is absorbed. That's the reason why it takes a lot longer to get drunk on beer, because you have to drink so much of it, and by the time you drink enough of it, you're usually full. In the stomach, alcohol is an irritant and does increase the flow of hydrochloric acid and pepsin. This is the reason why people who drink a lot oftentimes have what we call a peptic ulcer. The rest of our alcohol is absorbed from the small intestine. Anything that affects movement to the small intestine will affect absorption. Time from last drink to maximal absorption in blood is about 30 to 90 minutes. Again, remember you got about a 30-minute to 90-minute time lag before you're going to really feel the effects of that first drink. Now, there is absorption from large intestine. Most of it's absorbed by the time it gets there. A number of underage drinkers have discovered if you administer alcohol to the large intestine by doing liquor enemas, you can get very drunk. This is an incredibly dangerous thing to do, and something I would not ever recommend. So, alcohol is evenly distributed to the body. It freely crosses the blood-brain barrier. It also is freely distributed to the fetus. We'll talk in our next lecture about fetal alcohol syndrome. In particular about the fact that the fetus has about the same blood alcohol content as the drinking mother. Of course, we talked previously about that alcohol is available in expired air, and this is of course the basis for our breathalyzer tests, the concentration of which is about 1 to 2300, so those breathalyzers are very sensitive pieces of equipment. Alcohol is of course metabolized by the liver. Again, 95% metabolized by the liver, about 5% is excreted unchanged from the lungs. It can also be excreted in sweat. I can tell you I have had more than one student sitting in the front row of my classroom whose last night drinking was still on its way out through his pores. We talked already early in the semester about alcohol dehydrogenase, which breaks down ethanol into acetaldehyde. The maximum amount that can be metabolized is about 1 drink at a time. There's of course a metabolic chain involved here. Eventually it just becomes carbon dioxide and water. There are of course sex differences in alcohol metabolism. Women have a higher blood alcohol concentration for the same number of drinks, even adjusting for body weight. That's because women have 50% less gastric metabolism of alcohol, which leads to a 7% increase in blood alcohol content over men. Men have higher muscle-to-fat ratios, and as a result, more blood flow, so alcohol is more diluted in men. And women's higher fat content is simply physiology. There's a variety of fat tissue that is distributed differently in men and women. It's not that women are fatter, they just have more fat tissue, breast tissue, hip fat, usually used as stores for hormones. Anyway, but they store a little alcohol, which means more alcohol in blood plasma. So as a result, women absorb more alcohol, have more alcohol available, and it does affect them differently. There are, of course, some acute pharmacological and physiological effects. Respiratory stimulation at low doses, depression at high doses. So alcohol has this very paradoxical effect. It's both a depressant and a stimulant, depending on its dose. So it stimulates respiratory action at low doses, but you get depressed breathing at high doses. This is why people can sometimes die if they overdose. Alcohol is an anticonvulsant, which is why withdrawal can sometimes lead to seizures. It circulates in the blood, and as a result we get dilation of blood vessels in the skin, which feels warm, but that's because body heat is being lost. In terms of health, small amounts, less than 2 drinks a day, do actually lower the risk of heart disease and ischemic stroke. More than 14 drinks per week will actually increase the risk of stroke. Alcohol will induce sleep but suppress REM sleep, and of course it may cause early awakening. In terms of the psychological effects, we of course start with intoxication. Less than 0.04 blood alcohol content, very little behavior change. We start to get intoxicated around 0.5, where there's a 4 times increase in the probability of an accident. Once we get past 0.10, we're really into gross intoxication. We get up to 0.20, and we're into a stupor, then blackout, then it says sleep, but you could probably put in there coma, and then after that we're up to death. So low doses, which is largely determined by the person, that is the set and the setting. Alcohol can affect them from a variety of ways, can vary from relaxed euphoric to suddenly withdrawn and violent. Mental expectations are of course less important. As dosage increases, the drunker you are, the less control you have. You get of course progressively incapacitated as blood alcohol content increases, and blackouts start at around 0.25. It's of course much lower than that in anybody who has also taken a benzodiazepine. One of the important things to keep in mind with alcohol is it is disinhibiting, and it certainly plays a role in crime. Alcohol is implicated in over 50% of homicides and assaults. Over 40% of violent offenders in prison were drinking at the time of their offense. You get what's called alcohol myopia, which are cognitive and attentional deficits, which causes a focus on the present, reduces fear and anxiety, and impairs problem solving, and certainly impairs our ability to assess risk. Lots of people engage in risk-taking behavior they wouldn't engage in if they weren't drinking alcohol. It also can increase our concerns with power and dominance, particularly in males. This is linked to male domestic violence and conflict. Certainly a lot of fights have been precipitated by alcohol. No news to any of you, I would imagine. People who regularly ingest alcohol develop tolerance. There are 3 types of tolerance to drinking alcohol. The first is metabolic tolerance. And the liver increases its drug metabolizing enzyme. And so this is about 25% of our tolerance. We just get better at metabolizing alcohol. Other drugs have this effect as well. There is tissue, or what we call functional tolerance. The neurons in the brain adapt to the presence of alcohol. Blood alcohol content can be double in non-tolerant drinkers at the same level of behavioral intoxication. So this is behavioral only. We don't develop tolerance to the memory or cognitive effects, so people can still black out, even though they might not appear to be intoxicated because of their tolerance. And then there is what we call associative tolerance, which is an environment or related tolerance. People can actually drink more or less depending on where they are. So that's an important thing to keep in mind. Dependence, of course, can rapidly develop, and it's important to understand that withdrawal can develop in several hours. Common cause of adult onset seizures is alcohol withdrawal. It occurs in 10% of adults withdrawing from alcohol. Not necessarily that they've decided to quit alcohol, they just haven't had a drink and have a seizure as a result. An important part of detoxification will involve blocking seizures, and that's usually done through benzodiazepines or anticonvulsants. Of course, the benzodiazepines have a problem with abuse. There is this thing we call the kindling model, that is repeat alcohol withdrawal leads to an increase in the severity, greater likelihood of seizures. Those early withdrawal episodes are like kindling, they build a bigger fire. And of course you can end up with what's called the delirium tremens, which is a withdrawal syndrome involving tremulousness, hallucinations, psychomotor agitation, confusion, and sleep disorders. There are important side effects and toxicity that can develop with alcohol. Of course, we get a reversible drug-induced dementia. People lose their ability to form memories during alcohol abuse. We call it drunkenness. There is clear liver damage. My father was a chronic alcoholic and ended up needing a liver transplant because of his chronic alcohol abuse. Ethanol-produced oxidants, when metabolized by the hepatocytes, increase stress on liver cells. 70% of all alcoholism attributed deaths are due to cirrhosis of the liver. The seventh most common cause of death in America. There is digestive system damage, pancreatitis, chronic gastritis. We get destruction of nerve cells, particularly the pyramidal cells of the hippocampus, which can result in something called alcohol dementia or Korsakoff syndrome. So, lots of potential side effects and toxicity associated with chronic alcohol use. Small doses of alcohol, 2 drinks a day, healthy for you. Anything beyond that, binge drinking, particularly chronic binge drinking, is going to result in some damage. I do want to mention something I don't think your textbook talks much about, but it's incredibly important for you as college students to understand this phenomena. And I guarantee you, I'm going to have a question about this on the exam. And this is the mixing of alcohol and caffeine. And this is the danger of mixing alcohol and energy drinks. Now, of course, there used to be alcohol energy drinks available in one can, as it were, things like Four Loko, which are no longer available. But here is the danger. Alcohol has a linear metabolic rate. So if we look at this red line up here, you drink 10 drinks, which let's say is a lot. You're going to metabolize 1 every hour. Okay? So after 4 hours, we're going to have 6 drinks left. The line's not exactly right here, but it's going to take you 10 hours to get rid of 10 drinks. Caffeine follows a linear half-life, an exponential half-life, metabolic rate. So 10 milligrams of caffeine, we're going to then eliminate half, eliminate half, eliminate half. Okay. Caffeine, importantly, masks the effects of alcohol. So when you drink Red Bull and vodka, for example, you get lots of caffeine, lots of alcohol. The caffeine is masking the effects of the alcohol. Then what happens is the caffeine effects drop out and the alcohol effects stay. And what can happen is you can end up very drunk very quickly, even though you haven't kept drinking, because the caffeine has suddenly dropped out. It's a very dangerous combination. I'm sure there are a few of you who have had this happen. I've had it happen to me once. I made this mistake once with Red Bull and vodka, and never again. Just keep it in mind. It's fine to have one. If you're kind of sleepy and you want to go out with your friends, you have maybe one or two Red Bulls and vodka, don't drink them all night. Absolutely not. It's very dangerous. Not to mention you're going to get home, you're not going to be able to sleep, you'll be drunk, and you want to sleep, it's going to be a mess. So, anyway, important to understand, and I want you to be able to explain this to me in your own words, because there might be, for example, a short answer question about it. Okay. That's our introduction to alcohol. Next we're going to talk about alcohol abuse and alcoholism.